Hi, I'm Dr. Williams, and today we're going to do one of the newest and probably one of the best procedures for body contouring as well as skin tightening. What we're going to do is use what we call BodyTite. This uses a probe that is inserted deep in the tissue that produces radio frequency energy that results in heat that then causes a destruction of the fat cells and also produces at the same time skin tightening and skin contraction. The unique thing about this is that the probe that is placed deep under the tissue, under the skin, is monitored by this section that monitors the exact temperature and accuracy of the heat being produced. So this results in a very accurate as well as consistent and safe method for body contouring, fat removal, and skin tightening. And as you can see, what we've done is to outline the areas that we're going to use this probe and liposuction for contouring. We're going to define the lower chest margins. We're going to define the midline abdominal muscles. We're going to define also the lateral muscles and define and improve the waistline and also remove this little bit of bulging in the lower abdomen. This will then allow us to create a very sculptured and contoured appearance to the stomach that we call high definition liposuction with BodyTite. All right, so now we're in the operating room, and this is the BodyTite device. As you can see, this is the probe that emits the radio frequency energy. And the advantage of this is that this energy is emitted only through this section of the probe. So it's very accurate and precise. Secondly, when the probe is put underneath the skin, this portion registers the heat and the amount of energy that's being transmitted underneath the tissue to the underlying area. So we have accuracy as well as control and of course safety, because within this there are cutoff parameters such that if this gets too hot, then the unit stops. So we have both accuracy and safety for this procedure. And what we're going to do, as I previously marked, is that we're going to define the lateral border of, we call the rectus muscle or the mid-abdominal muscle. We're going to go over the hip area, define that, and define the lateral waist area and the muscles that make up the lateral abdomen. And lastly, what we're going to do is we're going to separate the ribs and the chest from the abdomen. So we're going to come what we call the subcostal area and define this area as well. At the end of this, what we're going to do is come in the midline, define the mid portion of the abdomen, and then do the same thing on the other side of the abdomen. So we're going to start now and begin this. And what this is registering is the amount of energy underneath the probe here, deep in the tissue. And what it's doing is emitting radio frequency energy in very controlled, precise areas and monitoring that as well. And what you're hearing is the monitoring of what we're doing. And what it's doing is causing some destruction of the fat and tightening the fibers and the skin to result in a tightened and contracted skin. So we're not only removing some fat, but we're also going to be tightening the skin of this area.